Start whenever you are.
Right. Thank you. Well, good afternoon, everybody. Thank you for joining us. We are here with Dr. Neal Barnard. He is someone that I've admired for a time, and I then got to meet him last year, and I've been part of the Universal Meals program at PCRM, Physicians Committee for Responsible Medicine, that he started in 1985. He's a pioneer researcher in diabetes. He has done so many things in this field. In the plant-based, the plant movement is totally indebted to him for the work he has done. And I resonate with him a lot because he's also a big system thinker. And he's the middle child among 5 children, exactly like me. And I think he weighs exactly as much as I do, and he's the same height. So thank you for joining us, Dr. Barnard. It's a pleasure to have you.
Well, it's a pleasure to be with you as well. I do have a few comments to make, and then I'm happy to put things to discussion. Would it be okay if I showed a few images?
Absolutely.
Very good. Allow me then to just share my, if I may.
Okay.
Here we go. When we're talking, if it's all right, I would talk about this pandemic that we're dealing with now and lessons that might be providing for nutrition in general and things that we might want to be doing. This is obviously not the first pandemic that we have had. Perhaps the one that was historically most memorable occurred 102 years ago in 1918, when an H1N1 avian virus entered the human population and killed millions of people worldwide. Absolutely devastating. And although it was a long time ago, there are a great many parallels with what we're dealing with now. It was a virus. It came from animals arriving into humans and then became easily transmissible human to human. And because it was novel, it was new, it was something to which we really had no prior immunity, unlike, say, influenzas. Now, where we do have a certain amount of immunity because of all the influenzas we've been attacked by over the years. But at that point, it was a novel thing. And researchers took, obviously, a great interest in finding ways to prevent it. And eventually, many years later, we started to have vaccines. But there was quite a curious an article that I happened to come across in a newspaper that came out in Minnesota. And they described a case of a seminary where there was a large group of faculty and of attendees, 120 of them, all staying there. And of 120 people, 90 of them contracted influenza. And what was remarkable is that although in other locations, influenza led to hospitalization, to respiratory failure, and to quite frequent mortality, in this case, nobody developed even pneumonia. They had the flu, they were feverish, they were coughing. It was all the standard initial symptoms occurring in 3/4 of the people who were there. But nobody developed serious pneumonia, nobody died. And how could this be? And so attention went to, well, they were using unusual treatments. And needless to say, there were no treatments. I mean, there were no antivirals then of any kind. There was no antibiotic that could kill them, just like COVID today. So they thought, well, they're using warm compresses, they're resting in bed. All those things are undoubtedly helpful, perhaps in some way. However, what was remarkable is if you looked at what kind of seminary was it? Well, it was an Adventist seminary. And so the Seventh-day Adventist religion says, basically, thou shalt not smoke. So it was a huge group of non-smokers. And for a respiratory illness, that's good. They were all teetotalers, of course. And their diet was extremely simple. Vegetables and fruits and nuts. Whatever diet they ate before they arrived was replaced by this completely plant-based diet. So at the time, the newspaper article that I read was speculating, could these things somehow have some effect of helping people to be stronger in the face of the infection? It didn't stop the infection. The infection still reached them. 3/4 of them got it. But it seemed not to slay them quite so much. So we don't have clear answers on that, and we can't 100% apply that to today. But it has been such an interesting observation that people have wanted to follow up on it. So in the ensuing years, researchers have looked at how nutrition and immunity interplay, particularly with regard to viral infections. Now, I should say that the immune system has many jobs. The immune system has to recognize viruses that enter our bodies. It recognizes bacteria or other invaders. And it also recognizes cancer cells, and it finds ways to eliminate them. What is the immune system? It's our white blood cells, really. You have red blood cells coursing through your arteries and veins to carry oxygen to your body tissues. And interspersed among them are white blood cells that are the soldiers that go out and recognize invaders, engulf them, and destroy them. And one of the first things in the modern era that I wanted to point out occurred or was observed with an H1N1 pandemic that started in, or this report came from, I'm sorry, this report came from 2011. The pandemic really started in the US in 2009. So this was an influenza. It was a relative of the one from 1918, but this one began in the US. And this observation was that if you looked at all the people in the state of California who contracted this, half of them were obese. Now, a lot of people in California are obese, but not half. And so the question was, why was it that overweight people were overrepresented? We're seeing exactly the same thing with COVID. Well, could it be that having too much fat on our bodies can create a problem? Well, researchers have also looked at fat that we consume. Researchers started a study where they fed a group of adults high-fat diets, and they fed them for 5 weeks, and then they would replace them with lower-fat diets and compare. And what they zeroed in on was a particular kind of white blood cell. It's called the natural killer cell. And as its name implies, it shoots first and asks questions later. The natural killer cell can identify abnormal cells that don't belong, or abnormal, or I should say out of place organisms like viruses, and engulf them and destroy them. And there is something about a high fat diet that reduces NK cell activity, or natural killer cell activity. How that works, we don't know. But the way I like to think of it is that your white blood cells are your soldiers, and the soldiers just can't work in an oil slick. If they are out trying to patrol your bloodstream and it's all filled with grease, they don't do very well. Now, so what I've said so far is that there is something about diet in general that does seem to improve immunity, specifically against viruses. And part of it might relate to fat, either fat that is on our bodies or fat that we might be consuming. But researchers have looked in another direction and said, well, could there be things that help us? And let me say that I personally am not happy with the current state of evidence. Researchers are sort of groping along in the dark, but let me share with you a few highlights. Vitamin C is something that was really made famous by Linus Pauling. And at the time of his death, Linus Pauling was consuming about 18 grams of vitamin C per day. Don't try this at home. But whenever Linus Pauling spoke, we wanted to listen. The man had not one, but 2 Nobel Prizes. And the point was that vitamin C could make cold viruses less likely to cause disease in human beings. Now, the research on this is mixed, but overall there is some evidence that people who consume vitamin C on a regular basis tend to do well. Well, where do you find vitamin C? Vitamin C is completely missing in meat products. It's in plants, it's not in animals. So the more your diet is rich in plant foods, the more vitamin C you're going to get. It's not only in Florida oranges. They are the people who have been capitalizing on it for advertising purposes, but you'll find it in more humble and other products that are less likely to brag, such as broccoli and other cruciferous vegetables. They have their share of vitamin C too. To get to the range of vitamin C that people have been using in research studies, though, people tend to have to supplement because it's pretty hard to have enough broccoli, or for that matter, enough oranges to have 2,000, 3,000, 4,000 milligrams of vitamin C per day, let alone the 18,000 that Linus Pauling was taking. Vitamin D is not really something that naturally comes about through foods for the most part. In nature, it comes from sunlight on our skin. And researchers have long noticed that certain diseases are less common in the areas where sunlight is most plentiful. I'm talking about equatorial areas. Vitamin D is particularly known, of course, for helping our body to absorb calcium from the foods we eat. It also seems to have an anti-cancer function, but it may also be an immune booster as well. So what do? Normal sunlight on the skin is a good and healthy thing. Nowadays, if we are sequestered inside, we're not getting any sunlight at all. And many people don't get much anyway because they're working indoors or they're using a sunscreen. And a sunscreen does block out the UV rays that make vitamin D in the skin. And as you know, the sunlight hits the skin, that causes the initial forms of vitamin D to be produced. They then go to the liver and the kidneys where they're activated and you end up with vitamin D. But if you're not getting sun, none of that happens. So what can you do? If you live in northern Maine, you don't have to despair. Vitamin D is near as your pharmacy or health food store. And most people would say that 2,000 international units a day. It's not quite as nice as living near the equator, but it'll do in a pinch. Zinc is something that has become famous, really thanks to the efforts of one company that makes a product called Cold Ease. And if you go to any drugstore nowadays, the shelves are all empty because everyone has gone in there to buy Cold Ease. It's C-O-L-D, capital E-E-Z-E. All it is zinc in a little sugary pill. And what the manufacturers will say is it won't stop you from getting a cold virus. The cold virus will enter your body. And it won't even stop you from getting symptoms. But what it will do is it will shorten the duration of symptoms. And that appears to be true. So how can that be? It doesn't stop the cold viruses from entering your body, but it does appear to boost the immune system's ability to counteract it and get rid of it. So vitamin D is going to work in that way. Now you can get vitamin D. It's in whole grains and a number of other plant-based, no, I'm sorry, zinc. Sorry, forgive me for getting my wires crossed. You can get zinc in whole grains and other plant-based foods. And again, the manufacturers of supplements would like you to get it in that way. I would caution you not to overdo it. This is not something, in my view, to be taken as a pill on a daily basis, because just as too little zinc can be problematic, too much zinc can be a problem too. Okay, shifting gears. Garlic has been something that I have to tell you I've been skeptical about, because there have been lots of people saying that garlic is a blood purifier and it helps in many, many ways. And I have assumed that that's just because those people like garlic and they want to promote it for that reason. However, there was a study that was done in the United Kingdom in 2001. And it was a really good study, I have to say. It was 146 people, and they tested garlic versus a placebo, and they tested it for 12 weeks. And this was right during cold season. And during this period of time, they tracked who got colds and who didn't. And it was what we call a double-blind study, meaning some of the participants got dummy pills, placebos, didn't do anything. Others got pills with the active agent of garlic in them. It's called allicin, A-L-L-I-C-I-N. And that's what gives garlic its flavor and what seems to be its medicinal properties. So, but the pills look just the same. Here is what happened. The placebo-treated people had total of 65 colds over these 12 weeks among the volunteers, which is about 100, let's call it 146 total, say 73 per group. So about 65 colds total. But in the garlic group, they had only 24. It was about 2/3 less. And then you looked at how many sick days did they have. The placebo group, 366 sick days. The garlic group, what? About 2/3 less again. So there's something about garlic that does seem to be helpful. Now, caveat on this, it was a good study, it was well designed, it was big. But what always concerns me is I always want to look at who are these people who are doing it. And in this case, the researchers worked for something called the Garlic Center, which is a good business in the UK, where their whole job is to sell garlic type products. Now that doesn't disqualify them from doing good research, but it does mean that you want to look around and see, is this, I think it's useful to maintain a little bit of skepticism there. Okay, let me shift gears a little bit. Let's say a person is now dealing with the 2020 pandemic of COVID. What has particularly been in the news over the last, 3, 4, 5 days is that this is, we are seeing the racial disparities play out in a very troubling way. As of April 3rd in Milwaukee County, African Americans were 26% of the population, but 81% of deaths. Then in the state of Michigan, also as of April 3rd, African Americans were 14% of the population, but 40% of deaths. And here in Washington, D.C., where I live, we had African Americans are about 46% of the population, but 58% of deaths, or even more. Well, what's that about? Now, some people have said, okay, well, African Americans may have poorer access to healthcare. It's true. They may also have jobs where they are interacting with people more. It may be that they are less likely to have a private office. It's more difficult to be socially distancing. All those things are indeed possible. They may also be more likely to be deemed essential employees. They are the people who have to be at the hospital or whatever. I don't know if those things are playing out, but it's possible. But here's, I think, something that we cannot neglect. There are underlying medical conditions that don't necessarily dictate whether you capture the virus or not. But they may make a difference in whether you end up going to the ICU or not, and whether you live or whether you die. Now, if you're looking at this and you see the little pictures, you maybe see my picture, you might be able to move it around because I have some statistics in the right-hand column I'd like you to look at. Starting with obesity. People who are obese are more likely to, as I mentioned earlier, they were more likely to get H1N1. That was 2009. 11 years later, it's a big risk factor for COVID-19. Among non-Hispanic Black adults, 38% have obesity. Among non-Hispanic white adults, the prevalence is 29%, significantly less. Diabetes, also much more common in Blacks compared to whites within the United States, 12% versus 7%. Hypertension, among Blacks, 41%, among whites, 28%. Now, I raise the caution that these are figures in the United States, meaning that simply because a person is Black or white or whatever race they may be, that doesn't mean that they are likely to become obese or likely to have diabetes or likely to have hypertension. An African American may have very different health compared to a Black person living in Africa or some other country. The difference is very likely diet. Here in the United States, we have dietary habits that we have unfortunately been exporting to the rest of the world, but that are contributing to each of these health problems. Okay, so that, as I mentioned, say hypertension, very common among African Americans, less common among white Americans. When the COVID-19 emerged in China, this was one of the first risk factors to be identified. By that I mean about 40% of the people who had a bad outcome with COVID-19 were people with high blood pressure. So you think, okay, I need my blood pressure medication. And if you go to any doctor, the doctor is likely to give you an ACE inhibitor, such as lisinopril. ACE stands for angiotensin converting enzyme. And these are extremely common medications for blood pressure. However, if you look at how the COVID-19 virus enters your body, it enters through something called the angiotensin converting enzyme 2. This is an enzyme on the surface of the lung cells and also on heart cells. And the COVID virus moves along, say through the bloodstream or through your respiratory tract. And it can attach, its little spikes can attach to this enzyme and enter the cell in that way. Here's the problem. ACE inhibitors increase the production of this enzyme. What I mean is they are sort of throwing out the welcome mat to the virus to enter the body. Now, this was pointed out about a month ago in a very prominent medical scientific article that got a lot of attention at the time. Since that time, we don't know what to make of it. And scientists have lined up in two camps. One camp says, this is the problem. If you take these medications, it may well increase the likelihood that you'll contract the virus. But many others are saying, no, that's not the case. It may well be that A, controlling your blood pressure is helpful, and B, it could be that these medications might actually work as a treatment. Where are we as of today? Nobody knows. However, it does suggest that if we can treat blood pressure in some other way, maybe that would be a good idea. By the way, just for completeness, your doctor may also prescribe an ARB, as it stands for angiotensin II receptor blockers. They seem to have exactly the same effect. So going from one to the other is not going to reduce the likelihood of them increasing this, what I'm calling the welcome mat. Okay, so I mentioned that hypertension might be treated in another way that doesn't involve pharmaceuticals. And a person might say, well, swell, I mean, if I had been following a healthy diet 20 years ago and exercised, maybe I wouldn't have hypertension, but there's no hope for me now. Let's look back in time. Perhaps the most famous blood pressure study ever done was called the DASH study, Dietary Approaches to Stop Hypertension, DASH. Big study, 459 people, and very well controlled. And let me show you what they found. The top line here is a group of people who followed the control diet, meaning it was just the regular diet that they normally were on. Meat, dairy, eggs, bread, you know, whatever. And their blood pressure didn't really change much, as you can see. The second line, the line below it, is of individuals who increased their fruits and vegetables, and they increased them substantially. So what's happening? Fruits and vegetables have potassium, which lowers blood pressure, and they don't have much sodium. Sodium raises blood pressure. Fruits and vegetables don't really have much of that naturally. So the more fruits and vegetables you eat, the lower your blood pressure it's going to be. But wait a minute, what's that third line? There's a line even lower. Those are people who increased their vegetables and fruits and reduced meat and reduced fat. It was the combination. And there you see that blood pressure lowered even more. Why would that be? Well, I'm avoiding the sodium because fruits and vegetables don't have it, hopefully, unless it's added to the canned vegetables and so forth. I'm getting plenty of potassium to lower my blood pressure, but I'm also avoiding meat and avoiding fat. And when a person does that, the blood becomes less viscous, less thick. And if your blood is more like water and less like grease, your blood pressure goes down. We believe that your heart just doesn't have to push so hard to get that lower viscous, less viscous, more watery blood through your system. Okay, so what I've shown you now are figures for systolic blood pressure. When you get your blood pressure checked, they give you two numbers, 120/80. 120, that's systolic. The bottom number, or 80 in this case, is diastolic. And there we see exactly the same thing. The people who follow the control diet, they don't make any changes, their blood pressure does not improve. But the people who increase vegetables and fruits, diastolic goes down. If you also dump the meat, your blood pressure goes down even further. Okay, but when I started at the beginning of this point, I said, you know, people with hypertension are likely to think too late. Well, let me show you something. I put in an arrow at the point where blood pressure seems to seriously drop. And as you notice, although this was an 8-week study, blood pressure dropped within 2 weeks. So it's not just that you have to take a year to lose all that excess weight. That would be good. But even before people have lost substantial amounts of weight, their blood pressure can come down. So am I saying that an underlying condition like hypertension that was there in 40% of the people in China who had a bad outcome, that hypertension can be changed in 14 days' time? Yes, that's exactly what I'm saying. Will this save you from COVID? We don't know. It hasn't been tested. But I would say if you're on the railroad tracks and the train is coming toward you, good time to get off. Now our group, these are data from our research group on the same kind of comparison, but now it's type 2 diabetes. And what we track is hemoglobin A1C. This is a measure of your blood sugar control over the preceding 3 months or so. And if a person has diabetes, I want to see it below 7 to call it well controlled. So we brought in a large group of people. They averaged A1Cs around 8, not very good control. Half of them went on a conventional diet, cutting calories, limiting carbohydrates. That's the red line. They improved. Their A1C came down. By 11 weeks, it was down, about 0.4 points. And then between 11 weeks and 22 weeks, it actually crept up a little bit. That's the red line. But look at that blue line. That's people on a different diet. They ate vegetables and fruits and whole grains and beans, a completely vegan diet. And by about 11 weeks, their hemoglobin A1C had dropped by almost 1 full point. For some people, it drops very, very rapidly. Within a matter of just a couple of weeks, their blood sugar control improves. So my point is that we want to use diet changes not just to improve our immunity now. That's great, let's see what we can do, and we need more testing of it. But the underlying conditions are the difference between life and death, and we should be tackling them. Okay, last thing, I just want to give you a little curious detail. Researchers in China reported something fascinating, and this came out about just a week ago or so. They reported on more than 2,000 individuals who had contracted COVID. What they noticed is that blood group A, if you check your blood type, people with blood group A were more susceptible to the virus. People with blood group O were less susceptible. As soon as this report leaked out, criticism was heaped upon these researchers by people who said that couldn't possibly be the case. What could this mean? And that it hadn't been properly peer reviewed, it hadn't even been published yet. People are jumping the gun, They got all beat up. I want to say that there could actually be something to this. Here's why. Back 4 years ago, there was a meta-analysis of studies of different blood groups and their risk of coronary artery disease. And people with blood group A had a 14% increased risk of coronary artery disease. And for people with blood group O, it was the opposite. They had less risk. Okay, so blood group A, those are people who have certain, just a slightly different genetic makeup, meaning that they are more likely to have coronary artery disease, and it looks like they're more susceptible to a bad outcome with COVID-19 because coronary artery disease is an underlying condition. So you might be thinking, oh, sorry. Let me add one more piece to this. The Nurses' Health Study and the Health Professionals Follow-Up Study, these are two huge Harvard studies. They found the same kind of thing, that if you don't have blood type O, you're 11% more likely to have heart disease. Okay, so what does this mean? You can't change your blood type. But if you are blood type A, you are likely to run a slightly higher cholesterol level, and you are more likely to have heart disease than a person who has type O. They're slightly less likely to have those problems. But what does this mean about diet? Back in 1996, a well-meaning but ill-informed author wrote a book called Eat Right for Your Type. And what he said is if you're type A, you should eat a mostly plant-based diet. That was true. People with blood type A who ate a plant-based diet did well. But he said, if you're blood type O, you're a hunter. You should have a lot of meaty things. Well, our research group has fed plant-based diets both to blood type A and to blood type O, as well as type B and type AB. And you know what we find? We find that everybody does well on a plant-based diet, whether they're type A, type B, type AB, or type O. So it is true that your blood type may influence your risk. However, that everybody does better on a completely plant-based diet. It's sort of like there are genes that mean that certain people are more likely to have problems from smoking. But that doesn't mean that some people need to be non-smokers and other people should smoke a little bit. Everybody does well as a non-smoker, and everybody also does very well to get the animal products out of their diet. And I said this is the last thing, but I actually want to share with you just one other thing. When you turn on the news nowadays, you're going to hear a number of people pitching medications, and the subtext is that maybe we don't have to pay any attention to diet and lifestyle, that medications are one day going to save us. I hope that medications do arrive. I hope that we get vaccines. I hope these are all effective, and I hope they're safe. However, there is no vaccine for COVID-19 now, and there will not be for a good long time. And even if there is one, if and when there is one that will be produced, it's going to miss. There are people it's not going to help, just like the flu vaccines are sort of a best guess. that the manufacturers make each year when they market it. And there are a lot of people who are not adequately protected. The White House in particular has been pushing chloroquine and hydroxychloroquine as the drug that's going to save everybody. It's been marketed for a long time. It does have legitimate uses against infection. However, in Brazil, just yesterday or the day before, they reported the initial results of a very troubling study. 81 research participants, these are sick people, they're in the hospital, they got COVID-19. They tested a high dose of chloroquine and a low dose of chloroquine. In the high dose group, of 41 people in that group, 16 of them died. In the low dose group, out of 40 participants, 6 of them died. So the Brazilian government said, stop the high dose group at least. It's somehow doing more harm than good. What does it do? All drugs have side effects. And in this case, one of the not uncommon side effects of chloroquine is something called ventricular tachycardia. That means the large part of the heart, the ventricles, start suddenly beating uncontrollably rapidly. That can kill you. The government of Sweden said, do not use chloroquine at all, full stop, for COVID-19. So this is chloroquine. There is a modification of it called hydroxychloroquine. And the hope is that it will be safer. And I think that's likely true. However, both of these drugs have the ability to kill people, as well as some therapeutic potential. So that has led all responsible researchers to say, we must be very, very cautious about going forward. So the reason that I'm mentioning this is that we need to take a look at our diet first and other things. We may need medications in addition, but we don't want to miss what's there. So I'm going to call this a little bit of good news. In Sioux Falls, South Dakota, Smithfield, which is, as you know, an enormous pork producer, biggest in the world, they closed the Sioux Falls, South Dakota Smithfield plant. One out of every 20 pork chops in America comes from this exact building. But the governor of South Dakota had found that over half of all the people in the whole state who had COVID-19 worked in that very building. So shutting it down, not a moment too soon. Also, chicken farming is, as you know, done on an industrial scale. The birds are raised from chick to slaughter in 6 weeks. And now in the suburbs of Washington, D.C., all around Maryland, Virginia, Delaware, there are huge buildings just like this raising chickens. What we are now seeing is that the slaughter plants themselves are so affected by COVID-19, they've lost their labor force, that there have been about 2 million birds that had to be killed, not at slaughter, but at the farm, because it wasn't worth it for the farmer to even bring them to slaughter. Lastly, the Mexican government closed down not coronavirus, but Corona beer, because they determined it not to be an essential business. So one might say the same thing about pork and about chicken, and there you have it. Let me stop at that point and unshare my screen and take any questions or comments that you may have.
Thank you so much. That was very informative. It actually leads me to the question that I wanted to ask you first, which is, why doesn't the CDC and the medical establishment present this information to the public? Diet.
Yes, that's a terrific question. And we have wondered the same thing. And our medical society here, the Medical Society of the District of Columbia, wrote first to the mayor of the District of Columbia, and then also wrote to the White House task force. And what they said is that we need to address the underlying conditions, like hypertension and diabetes, because as important as hand washing is and social distancing and masks, and they are all very, very important, they often fail. And we have to be able to have people tell people to bolster their health. So there is an outcry among physicians to change what's happening, but this information hasn't really gotten out from government sources. The White House task force is on television every single night during prime time. And there are some very, very good people on that task force. But while there are infectious disease experts, there is not one single expert in diabetes, in hypertension, or obesity, or smoking, or any of the underlying conditions. What we have asked the task force to do, and our mayor and others, is to ask the American population to do three things. Number one, if they smoke or vape, to stop. Now, of course, who would ever smoke or vape? Well, the answer is 1 in 7 Americans is doing that. It's a lot. Number two, get their medications regulated. Very often people take their medications in a haphazard way. That needs to change. And number three, to improve their diet, specifically boost vegetables and fruits, reduce meat, reduce fat.
Right. Second, you talked about the meat plant closure in South Dakota. And the meat industry is now looking for stimulus money to tide over what's happening to them financially. How is it possible to get stimulus money to transform meat-based agriculture to plant-based agriculture?
I think that's the $64,000 question, I have to say. I think it's the greatest question. And politically, it's very challenging. As you can see, there's a huge amount of money, and it's been in the headlines lately as the scandals about where that money may go. But there is, I think, a very good precedent for exactly what you're suggesting. The idea is, okay, the people who got into the pork industry or the chicken industry, they're good people. They just got into an industry that has many bad sides to it. And you might say its time has come. So one might want to help those people to transition out of that industry, whether they're at the bottom of it or the companies themselves can diversify. There's a good precedent for this. Tobacco farmers, people who got involved in that trade were good people. And then suddenly people realized that tobacco causes lung cancer and many other issues. So the government did provide funds to help tobacco industries and tobacco farmers to find other ways to use their land. You can't grow just everything on that land, but you can grow strawberries and some other things. And there has been help for them. I would like to see exactly that happen.
Right. Third one I wanted to ask you, because I've been watching the coronavirus coverage and the way the statistics are being tracked in the world, and how it gives feedback to people as to what is really going. Based on that, they can decide, what are they going to do? Should they stay home or not? Can we do something similar for diabetes, for disease, stroke, cancer? Have the statistics across all countries, so people see how many people are really dying, how many people are going into critical care for those chronic diseases.
Just to make sure that I understand, are you saying that can we use the information that we have on the toll that is taken among people with underlying conditions? Can we use that to inform other countries about steps that they could take?
No, I was asking, can we create similar meters, similar running statistics?
Oh, I see.
On heart disease, on cancer, so that people see the effect they're doing to their diet.
It certainly would be. Those statistics do exist.
Okay.
People, it's relatively easy to uncover the statistics on diabetes, on hypertension, and all these conditions. But I think what you're saying is really important because they don't have the immediacy. Right now, people are tracking COVID-19 day by day. People can recite how many people in the United States have died of this as of midnight. So that it has a great presence in the public consciousness, whereas the number of people dying of cardiovascular disease and cancer, even though these numbers are far greater, tend to be relegated to medical journals. I think it is good to bring those statistics to the fore. I think a big problem we have is that people tend not to take a threat very seriously if it's been around for a long time, if it's considered culturally normal. And I remember during my own childhood, we thought, well, if you're in your 60s, you're old. It's likely you'll have a heart attack. If you have cancer, it's genetic. We didn't think of these things as relating to diet and lifestyle changes that we make, but that kind of reminder is so important because it can save your life.
Yeah, it gives feedback to people, and the more feedback you have, I mean, maybe you should start something on PCRM.
Okay, all right, that's a great
like
suggestion.
Next question, you have the 21-day Kickstart program. That does that also have dietitians and doctors helping people as they do the transition in the Kickstart program?
Thank you for asking about that. Yes, for anybody who has their iPhone or their Android, they can download the app for our 21-day vegan Kickstart. And it's 21 days worth of menus and recipes, plus cooking videos and all kinds of tips and links to hundreds and hundreds of recipes. It's completely free. There's an English language version and a Spanish version. And it's used in really two ways. One way is that doctors use it as a tool. So the patient has only a limited amount of time with the doctor, and the doctor says, here's the app, download it before you leave my office, and I want you to check it every single day and do what it tells you. And it's engaging and fun, and so it's sort of a medical prescription. But the other big use of it is that people are just using it themselves. And I think far more people are using it without their doctor even having asked them to do it. We've had hundreds and hundreds of thousands of people using it. So anyway, for anyone for whom this is new, it's the 21-day vegan Kickstart, and it's free, it's nonprofit. We're not selling anything. It doesn't emphasize having anything. But it's fun and engaging, and will, for many people, change their lives.
But does that contact with the doctors and dietitians who help if they have questions?
Yes, if people are interested, hopefully their own doctor or dietitian can help them. In the event that they don't, let me just mention that our own clinic here, which is a nonprofit medical center, the Barnard Medical Center, will offer that for people who may not have it in their own lives. And it's a new thing for many people. The idea that I can actually talk to a doctor without getting in my car and going to their clinic, and the answer is yes. So at the Barnard Medical Center, we see people not in every state. We see them in New York, in California, in Maryland, Virginia, the District of Columbia, Missouri, Massachusetts, and Connecticut, I believe it is. Connecticut or Delaware. Anyway, we're growing all the time, and including more and more states. And it's perfect for exactly this kind of thing, where a person has high blood pressure or diabetes, and people will say, my doctor never talks to me about nutrition, help me out. So we're happy to do that. The website is barnardmedical.org. It's just barnardmedical.org.
Awesome. I have one last question, and then I'll leave it to the audience to ask questions for you. The last question I have is, the recipes that you have on the app, or the recipes that are there on the website, are they all universal meal recipes, or are they not necessarily universal meals?
Oh, my favorite topic. Thank you for asking. Yes, universal meals is a new idea where we wanted to find foods that would work for everybody. And so that means some people are following a vegan diet for whatever reason, either for health or animal welfare concerns or the environment. Other people might be gluten-free. Some people have allergies. Some people have religious prescriptions, say against the use of alcohol or shellfish, or you name it. And so what we did is we took all of these considerations and made recipes that work for everybody. So the recipes that you'll see on the 21-day vegan Kickstart are not necessarily universal meals. They are all free of animal products, and most all of them don't use added oils. But on the other hand, they might have one or more, say, allergens in them, and they might have gluten. So if you're trying to avoid gluten, you'd want to take that extra step of avoiding the ones that have wheat, barley, or rye in them, for example. Or if you have a peanut allergy, you might have to skip the peanut sauce. But they do get you the bulk of the way there because they're all free of animal products, which is great. And they're all pretty much free of added oils too.
Yeah, perhaps, would it be easy to just tag each recipe with a U or no U, if it's a universal meal?
The Universal Meals program is something that's new, and I'm eager to see how it goes. And we have developed a little logo, and we've got some extra super great recipes that we developed with the Culinary Institute of America, the CIA, and also with the Spork, the other CIA, and also the Spork sisters, who are some very cool recipe developers and caterers in California. And so we are super eager to see this roll out. And as soon as everybody is able to get out of their houses again and to go to their college cafeteria or go to their local restaurants. We're hoping that the universal meals will make their appearance.
Awesome. Thank you so much.
Sure. Well, thank you so much.
Deborah, you have questions from the audience? I'll leave it open to that.
Yes, we do. All right, I'll start with the QA box. We have a question from Miles. It says, I recently found this, but I have not yet read it. Food in the Anthropocene, the EAT Lancet Commission on Healthy Diets from Sustainable Food Systems. Are you familiar with it? If so, any comments? Thank you.
Yes, this was really quite an influential publication. The Lancet is a very well-known medical journal, of course, and Dr. Walter Willett at Harvard University is the head of the School of the Nutrition Department there, and just one of the top researchers in the world. He and colleagues led this research enterprise that really looked at the interface between health and the health of the planet, and came out with a prescription not just for healthier eating for your own personal biology, but to help reverse the destruction of the planet that has been ongoing for quite some time. It's a huge step forward, and to the extent that people not only reduce their use of automobiles and all the other things that people can do to reduce climate change, but also in their own lives through their own shopping and eating habits. If we put those changes to work, we can collectively have quite an impact.
Excellent, thank you.
Sure.
Okay, next question from Dot. Could you say something about animal testing and how that affects the process of a new vaccine being ready? What are the most promising alternatives and animal-free vaccines?
Okay, this has been a really hugely important area. Typically, vaccines produced in a number of ways, but the classic way of manufacturing a vaccine is used with chicken eggs. You take a fertilized egg, there's a chick inside, and viruses are injected and vaccines are produced. It's a slow process, it's hit or miss, it's very expensive, and there are companies that have gone way beyond that. And in fact, there is, in our clinic at the Barnard Medical Center, if a person comes in to say, I want the flu vaccine, but I'm allergic to eggs, I've been told I can't have an egg-derived vaccine. Well, we have one. The best flu vaccine is by a company that markets it called Flu Block. No eggs are used at all. So that was a huge step forward. So with regard to vaccine development in the first place, when the vaccines are just originally tested, they can be manufactured without animals at all, and they can be tested without animal tests. The first vaccine, at least that I saw, after the COVID-19 emerged in China, the first vaccine to go into trials went straight to humans without animal testing at all. And that's going forward. It's still a very slow process. And it's also possible people may back up then and test it in various species. I rather wish they didn't. But you go from the lab bench into safety testing and then ultimately efficacy testing directly in human beings. You have to be extremely careful about this, but we should not assume that testing anything on animals ensures safety in people either. When I was a medical resident, we had vaccines that produced serious neurological complications. It was called the Guillain-Barré syndrome. It came from vaccines. So the vaccine experts are well aware animal testing is not a guarantee of safety, and many of them are moving beyond it for that reason, plus speed.
Thank you.
Sure, great question.
Okay, here's another one from Claire. I've been publicizing the statistics on how chronic diseases are a risk factor for COVID-19. The irony, of course, is that those chronic diseases themselves are caused by meat eating. Can we not make it clear to people that these comorbidities are caused by meat, and whereas under normal circumstances, people might have been able to live with these chronic illnesses with medical advances for 10 to 20 years, now if you have them, it could mean that you die within 2 weeks from COVID-19. This should surely focus people's attention on the risk of a meat-based diet, that you are a sitting duck for far more severe ramifications if you contract COVID-19. your comments, please.
Yeah, very, very well said. One can only observe that a meat-based diet has greatly increased the risk of heart disease, of certain forms of cancer, particularly digestive cancers like colorectal cancer, but also hormonal cancers like breast cancer or prostate cancer. An animal-based diet increases the risk of all those. And that should have discouraged people from consuming meat. And in fact, it has. Many people, as a result of that, have adopted plant-based diets to reduce the risk of cancer, to reduce the risk of heart disease, or reverse their heart disease, reverse their diabetes, tackle weight problems. Lots and lots of people are making that change. But many people have ignored that. And then it's not just these huge population-wide problems we have, it's damaging the earth and destroying the earth that we live on. And some people have paid great attention to that and changed their diet, and others have ignored it. And now we are at the stage now where, because somebody couldn't resist, apparently bringing bats and other animals into a live animal market in Wuhan, China, and then animal viruses have now entered the human population, that's the failure to close a single market in China has led to the closure of markets and stores worldwide. And you would think at some point the price of exploiting, killing, and eating animals would become more than we wish to support. My fear is that once this current stage is over, we'll put our party hats back on and our blinders go back on, and some people will go back to the very same problems that caused us in the first place. That said, you can't unlearn something, and people have this image in their mind of bats in a cage. And if they've seen the pictures, it's bats and rabbits and deer and chickens and ducks and all these animals mixed together that become really a cauldron where viruses mix together. And then they learn that it's not only in Wuhan, it's not only in China, it's in New York City, it's in California. We have these same kinds of live animal markets as well. And we have even far more dead animal markets where you have cholesterol and saturated fat on sale. Let's hope that we've learned our lessons a little bit better. But our job, and I know that's also true for those of many people on this call, is to raise the megaphone to our lips and make sure that we're as loud as we can be.
Thank you. So well said. All right, I'm going to go to Rebecca. She's got some questions for you.
Hello. This is a question from a representative of the Agricultural Fairness Alliance. Regarding the pandemic risk, what ideas can you offer for reframing the risk of the pandemic from the factory farmed animals with respect to wild animal markets? She finds that people are very focused on SARS-CoV-2 being from Chinese virus rather than realizing that these pathogens are brewing in all livestock all over the world.
Yeah, I agree with the thrust of this question, which is that there are problems in these, you might say, smallish markets, although the Wuhan market's considerable size. But what the person might be thinking of is that a factory farm could have enormous numbers of chickens or pigs or cows. That's certainly true. The disease processes are not totally dissimilar. The process by which influenza A arrived was probably a very small scale. It was very likely an avian virus that was in perhaps a duck or related species, who then nested down near a flock of chickens or other birds, or maybe some fecal material was transferred from one to the other. And once it entered other birds, domesticated fowl, then the people tending those birds would then pick up the virus. And then the people that they interacted with would pick up the virus. And then pretty soon it became fairly easily transmissible from one person to another. So it then became a human virus, and we've got it ever since 1918. With regard to factory farms, it's a little bit different. The animals may be enclosed. However, pathogens arise over and over and over and over and again. In fact, just about a week ago, maybe 10 days ago, something like, in South Carolina, if memory serves, it was a big turkey farm. And a new pathogenic virus arose. And viruses arise all the time. What was new is that this was a high pathogenicity virus. I believe it was not H1N1, it was something like H7N3, something like that. And they had to just basically take out the whole herd because this was not only easily transmissible, but also a killer of the birds, at least. And one might say, oh, well, that's just one case. Well, it's not just one case. It was, I think, 2015, or whatever it was, a similar pandemic in the birds led to the deaths of, what, 2 million chickens were either killed by the virus or had to be culled to keep them out of the human food chain. So the bottom line is in nature, animals are spread out and human beings don't capture them and live with them and work with them on a daily basis. So if they may have a virus that doesn't cause them any harm, they're not going to transmit it to you. Once people decide they're going to domesticate them, live among them, work them, eat their bodies, you're just inviting the viruses to enter our system. And it's not just viruses, but bacteria as well. And I'll give you a creepy statistic. Researchers have looked at the bacteria that cause ordinary urinary tract infections. You can get a urinary tract infection, but 80% of the time, 70 or 80% of the time, those E. coli that cause the urinary tract infections came from chickens. That's right. The chicken raised on a factory farm, they're spreading these bugs amongst each other. They're at the retail store. You bring the chicken home, you clip off the plastic, and a little bit of chicken juice dribbles on your counter. And then you suddenly realize chickens are not fruit. They don't have juice. What is this water on my counter? And what it is, it's water from the cooling bath at the slaughterhouse where the carcass went in to cool down. And for the first 100 birds, fairly clean. But after that, it's this fecal soup that gets into the chicken's skin and muscle tissue, and it dribbles out on your counter. And it's loaded with live bacteria that it's not that hard for them to end up in your mouth, colonizing your digestive tract and leading to all kinds of problems, including urinary tract infections. So when researchers have done the genetic fingerprinting of these bugs and matched them with urinary tract infection pathogens, it's about 80% of the time, that's where you got it. So that's enough to make you a vegetarian.
Thank you.
Sure.
Another question is, can an immediate change make a difference in immunity for COVID or other diseases, immediate diet change?
Okay, keep in mind, COVID is new. COVID only arose on New Year's Eve. So nobody has really done good studies to show, okay, if suddenly now you become vegan, you throw away the cigarettes, you're getting your medications exactly in line, and you're eating garlic for morning, noon, and night, nobody really knows if that's going to affect COVID or not. But we have reason to believe that these will, based on the experience with other viruses. The garlic example I gave was not COVID. That was cold viruses, which are a relative, and your immune response is not dramatically different. The underlying conditions change fast. The studies that I described, the study I described to adding fat to the diet, that was a 5-week study. So yeah, these changes in diet will affect our physical responses quite rapidly. 2 weeks for blood pressure, 5 weeks for immunity with regard to reducing fat. Yeah.
Great. Thank you.
Thank you.
And are you seeing any changes in your cohorts due to the COVID and a plant-based diet?
What kind of changes are you thinking about?
Are you seeing any doctors changing what they prescribe or becoming plant-based?
Oh, well, I have to say, we have been seeing that transition on an ongoing basis for quite some time. And it would really make your heart sing if you were at our annual conference that we have. And I know many of you have actually been there. But it started out as some hundreds of people. And then last year, you look around the room and here's 1,000 doctors all getting totally pumped up about what a plant-based diet can do for them and for their patients. And each one, they go home and they tell other people about it. Now, so that's great. And that's been going on for quite some time. And I think with COVID-19, it's doing some good things for all the horror that it's causing. It's making people more attentive to the fact that life is fragile, that assaults are all around us. We do need to protect our families and our children, and not just with hand washing, but with what goes into their mouths. We've got to be paying attention to that. Now, so those are all good lessons. But keep in mind, there's a lot of wishful thinking out there. Once people are back at work, this is all going to be a memory. Old habits will return. And there's also a lot of noise out there. For everybody advocating a healthy plant-based diet, there's somebody else with a keto diet, a paleo diet, some other goofy diet. And there's money behind these things, and that's not going away. So our work is not finished. We have to keep pushing hard to make sure that the message gets out there. And we have to keep doing the research that we're doing as well to make sure that we have the latest data.
Thank you so much, Dr. Barnard. That's all the questions I see here.
Well, I want to say a big thank you to...
We have more on Facebook, though.
Okay.
Do you have time for a few more questions?
I have time for maybe 2 more questions.
Okay, perfect. And thank you so much. If I were not vegan, I would be going vegan after this talk, for sure.
Well, thank
I
you.
really appreciate what you're saying. So I'm going to go to Anne. You have the questions from Facebook?
Yes, and not too many. So you've talked about this quite a bit, but Kelly says, I've been vegan for 4 years. I'm pretty sure I had COVID-19 in early February and I was never diagnosed. I stayed home, got better. I'm wondering how much my vegan diet played a role in getting better.
It may well have, it's impossible to say, but you remember the anecdote that I started off with earlier, where this is really before modern virology testing back in 1918, where the people on this simple plant-based diet, and back then this was before the age of impossible burgers. People were eating, green beans, they were eating, dried beans, they were eating vegetables from the garden, eating fruits, eating grains, very, very simple foods, and they did very, very well. And so many people have the same observation now, that if they're following this kind of diet, they seem to do well. But I would encourage people not to be overly confident about it. We do need to wash our hands. We do need to do appropriate social distancing. Got to wear the masks now, all that stuff. Wash our produce when we get it home, and just be as careful as we can. But in the same way as you put the right gas in your tank, the car runs better. Put the right fuel in your body, it's going to have stronger immunity too.
And the other question has to do with any advice that you would offer to young pregnant women in the middle of this pandemic who are not yet vegan, but feeling very strongly like they should be.
Yeah, well, first of all, anytime is a good time to go vegan, and during pregnancy is an especially important time because you're eating not only for your own health, but for your baby's health. Yes, it's a time obviously to be hygienic and obviously to eat healthful foods, and to just be very clear, the rules for a pregnant woman are about the same as the rules for everybody else. Vegetables, fruits, whole grains, beans, you can avoid animal products completely. Don't forget your prenatal vitamins, that's important. That's got vitamin B12 and other things in it that you do need. You do need to see your doctor, make sure that your health is good, because even on a perfect diet, things can go wrong. There are some benefits to this apart from the theoretical benefits. There haven't been a huge number of studies, but the studies that have been done show that if people are on a healthy, well-planned vegan diet, birth complications are less frequent. And there has been an interesting observation that I just published I have a book called Your Body in Balance, which sometime I'd love to come back and tell you about it. It's all about how foods affect our hormones and fertility and endometriosis and menstrual cramps and hormone-related cancers and all these things. But as part of it, I talked about morning sickness. And I relayed the story of a young woman who had terrible morning sickness. And she was trying to think, why is this? This is my 3rd baby, and my first 2 babies, I didn't have any morning sickness, now I do. She started thinking, well, what about my diet? I was really strictly vegan for the first 2 pregnancies, but for this one, I kind of been cheating. When I've been out at a restaurant and they accidentally put cheese on my spaghetti, I didn't take it off. And if they buttered my toast, I didn't ask that, for non-buttered toast, whatever. And so she said, well, I wonder if would make the difference. So she threw out all the accidental cheese, and she discovered that her morning sickness went away almost immediately. What's that? What could that be about? And let me speculate with you a little bit about this. Researchers have looked around at what morning sickness could possibly mean. Like, what's the value of a poor pregnant woman throwing up? And a theory has evolved, and it's like this. When a woman, and forgive me for this long-winded answer, it was a very simple, good question, but I'm going to go at a little bit of length because I think it's interesting. When a woman is pregnant, she has in her body another body that's only half her. Half of the genes, the other half of the genes came from her partner or her husband. In theory, her immune system could reject the baby because the baby is not entirely her tissue. So her body during pregnancy makes progesterone, which actually weakens immune defenses. So you're not going to reject your baby. At least this is the theory. But if your defenses are weakened so you don't reject the baby, maybe you're not going to reject things you should reject, like viruses or bacteria or parasites of all kinds. So the theory is that morning sickness is a reaction to things that are potentially infected. And the foods that trigger it the most tend to be those that can be infected, like meat. Many women say, you know, when I was pregnant, I couldn't go anywhere near it, it would make me throw up. And in a number of cultures, there are actually prohibitions about meat eating during pregnancy. And so the idea is meat has E. coli and salmonella and all these things on it. When you're pregnant, don't go near it, and nature is going to make sure you don't because it's going to make you feel nauseated. So who knows? But the point is, this is a great time to go on a completely plant-based diet because every woman who's ever had an upset stomach during pregnancy knew, I'm okay with rice. You know, I'm okay with cooked vegetables. Fruit's pretty good, but if you give me that greasy steak, I am going to leave it in the gutter. Now's a good time to go vegan. But do remember to take your prenatals, eat your vegetables, eat your fruits, eat your whole grains, eat your beans. Green leafy vegetables, great for calcium and iron. Eat them in an abundance. Don't fire your doctor. Put it all together and you're going to do well.
Thank you so much. That is extremely helpful.
Yes.
And one last really short question. I seem to have missed how much zinc per day one should be taking.
Okay, I don't encourage people to actually take a zinc supplement at all. I think my prescription really is go ahead and take whole grains, also have beans, vegetables, and fruits as part of your regular diet. You'll be getting adequate zinc. The exception then is when a person actually has cold symptoms coming on, then you can go to the store and you'll get the zinc tablets, and they do have a certain amount of zinc in them. And they'll tell you the typical regimen is you take one every 2 hours, and you will get tired of them very quickly, and you're supposed to continue it for as long as you have symptoms. And so I would leave it at that. I would not go to the health food store and buy a zinc supplement.
Okay, thank you. Thank you very much. And I think that is, let me just take another quick look. Nope.
Okay.
Great. Well, I want to say thank you to all of you, and thanks for all the great work that you do to make people wiser and more compassionate. And for everybody listening to this, I hope that they'll spread the good word. The people who need this message the most didn't even hear about this program, so it's our job to let them know.
Well, thank you so much for joining us, Dr. Barnard. It's always been a pleasure.
Likewise, thank you.
Okay. So tomorrow, we're going to be talking to Jane Willis-Mitchell, same time, 1 o'clock. So that will be the last one interview. And then on Saturday, we'll have all the speakers come in the day, whatever time they can allocate to us. So we can ask them questions and we can brainstorm as to what we should be doing. Thank you,
Can you
everyone.
tell people what that window is for Saturday?
Saturday is from 9 a.m. to 5 p.m. Pacific time. I'll be there all the time, so but others will come in and go. Thank you very much.